Definitely, if we are just counting COVID confirmed deaths, we are underestimating the true death toll of COVID on Canadian society. It is very important to have up-to-date all-cause mortality death data, because if we are finding out a year later, as you had mentioned, or more, then that's not really helpful for us in the current pandemic. That will only be helpful for us in planning for the next pandemic and for the long-term effects of this one. So it's not really helpful for acute management of this time. On the end of the person filling out the paperwork, that usually has to be done in a prompt time. Depending on the province, it's usually within 48 hours, or if quicker if possible. Another issue is preventative health care. So things not considered urgent are preventative health because they're done on a healthy population. So screening like mammograms, pap smears, colonoscopies, stool kits. So these are not being done generally right now unless there's an urgent and non-screening reason. However, we do these for a reason in a normal situation. So the fact that we may not be doing it now, we have to make sure these are all caught up. Otherwise, it's not going to be something we'll see within a year or 2 years. It's going to be 5 years down the road, 10 years down the road. We may be missing, we may see an increase in breast cancer, colon cancer, or cervical cancer. Having that all-cause mortality data would also be important. So if we see that maybe the number of strokes or heart attacks has significantly increased, then maybe it's time for more public messaging to tell people these are the signs and symptoms of a stroke or heart attack. Do not ignore it. Go to the hospital. So we can target it to these populations or these types of symptoms so that patients are aware of the situation and hopefully mitigate some of the COVID-related damage.